Call the meeting to order. The agenda, Oromocto Town Council meeting, regular session, Thursday, 20th March, 2025, 5:30 PM at the Oromocto Municipal Building. I'll ask for a recording and I'll call for a mover for approval of the agenda. Deputy Mayor Mawhinney, Councillor Kirkbride, seconder. Questions? All in favor? Contrary? Motion carried. Is there any disclosure of interest?
I'll have to step up for a couple of those.
Yes, yeah. Okay, no problem. Then we'll move down to the mayor's comments. I only have one tonight, and it was yesterday afternoon. Our Oromocto Fire Chief Jody Price was given the King Charles III Coronation Medal at the fire station, plus his 40th year exemplary service bar, and they're both presented by my daughter Jenna Gowan, the federal MP, and that was at Station 1, and it was quite an honor for Chief Price, and I want to congratulate him on that.
Absolutely.
Okay. We'll move on to the adoption of the minutes, Oromocto Town Council in regular session, February 20th, 2025 at 5:30 PM at the Oromocto Municipal Building. I'll ask for a mover. Councillor Daw, seconder, Councillor Henry. Questions? All in favor? Contrary? Motion carried. There's no petitions, presentations, or delegations, so we move on to the councillor reports. We'll start with the Capital Region Service Commission, and I'll start with the first one. And Tuesday, the 4th of March, the RC 11 had their monthly general meeting, and they had a supper beforehand, and then the meeting started at 6:30, and it just went over the general meeting. Then on the 17th of March, they had a Zoom meeting from 4 PM to 5 PM, and it was on the regional doctor recruitment strategies in the region. So some of us were on the Zoom, watched that. And that's all I have for that. So we'll move down to 7A1, and it's a Community Development Committee, and I think Councillor Don.
Or I do.
Oh, you do?
Um,
Okay.
It's actually a joint report for this month, and it's in relation to the meeting that you had just mentioned in your report on the doctor recruitment that was given by Jennifer Peck. So both the Community Development and Economic Expansion Committees were both invited to that meeting. And it was basically them going over some of the initiatives that they've been taking to help recruit medical professionals to the capital region. It was interesting because they had data to go over how many professionals are we going to need within the next certain time period, and then some of the strategies that they were endeavoring to employ to try to fill some of those positions, all the way from recruiting to universities to being open to more lateral movement between provinces and even south of the border as well. So professionals looking to come this way. So it was encouraging to see the work that's being done, and we're just hoping to see some further results on that.
So, all right. We'll move on now to the Oromocto Healthcare Committee. And we met on the 17th at 5:30 PM here in Council Chambers. And we had Dr. Hanif Chator. He came to speak with us, and he was I was pretty impressed with the guy, actually. He's an emergency doctor. He works at a Waterville, but he spoke on the e-visit program. And it's where if you don't have a doctor or you don't want to go to the hospital and sit in the waiting room and stuff, you can go online. If there's a phone number, you go online and you register with them. And then once you're registered and you're in the program, you call up and the doctor will talk to you and see what your problem is, and they can give you prescriptions and advice. And if it's too serious, they'll tell you you got to go immediately to the hospital and things like that. And it's working up there really good. And it'd be nice to have it down here. And yeah, so it's a good program. And Sheridan, you probably have more to share because he was at the meeting too.
Yes, thank you.
So Councillor Kirkbride and Councillor Dawes.
Yeah, and further to that, it was a very interesting meeting. What he talked about the evolution of the e-visit program. And how there are currently about 300,000 New Brunswickers who are using and registered with that, but they were looking particularly for help of municipalities and communities of trying to facilitate scenarios where they can get their message out, particularly to populations who don't tend to be as savvy technologically. In the day and age where so many people don't have a doctor, he said that there were so many situations in which people are visiting clinics and emergency rooms in which they're not really situations in which they need to be at an emergency room. It's something where they're getting, prescriptions for rashes and prescriptions for acid reflux or those kinds of things. And he said that the more and more that we as a society and as a community here in New Brunswick can push people to get registered for e-visit and otherwise known as Maple, then it would really help to reduce some of the load for the critical patients who do end up in hospitals. So it was very interesting, and I know that there is a subcommittee that has been struck of this Oromocto Healthcare Committee that will be looking at ways in which we can get that communication out to our residents further. So there's more information to come on that, and hopefully we can do our part as a community to get that message out.
Yeah. Councillor Murdoch?
Is there a cost to that?
It's
Because
all
I
for
know
the
that when Jeff got sick, we went to Maple.
That's a cost.
It was a cost. So
For
this
Maple.
it's similar concept, but not a cost.
Yes, and what he was saying is that for those people who have a New Brunswick Medicare card, if you end up paying, they end up getting a refund.
Okay.
So the people who end up paying are people who may not be either Canadian citizens or people who are not New Brunswick citizens, but were here on a trip and they had to use the service, then they will be charged.
Gotcha.
He's registered under Horizon Health,
Yeah.
where the other one isn't private.
Yeah,
Okay.
yeah.
Okay. And what's it called?
E-visit.
E-visit?
And I had asked him the question, is Maple and that the same thing? And he said you had to consider that Maple was a separate entity, and then during COVID it was more of he contacted them to see if they could bring it under the same umbrella.
Right.
And then they worked with the Department of Health, who then said, yes, we will
We can do this
cover
too.
all of the services under that as well.
Perfect. Good to know.
I've used it myself a couple of times and it was completely free.
And once you call it, once you registered, and then you're just a registered.
Yeah, and I think the message we need to get out to people is that it's not, and what he said is it's not a replacement for having a family doctor. That is certainly the ideal, but it is a service on how people can get healthcare.
Could feel
And
it.
it may be a doctor, but it may be a nurse practitioner, it may be,
That's
it's
right.
people who can deal with that level of care you need.
Perfect.
Yeah.
Like that.
And they give you prescriptions and everything.
Yeah, like if it's something that the emergency doctor doesn't have to do in time, and they can do it. Absolutely, that's great.
And once it gets down in our area, what we'll do is we'll get it put online and,
So it's not down here. We can't do it now.
well.
You must-
I just think we need to clarify, we do have it in this area,
Yeah.
it's in the entire province.
Right.
What he was making mention of is that I think that there's a higher degree of people who are registered in the Woodstock area, because that's where it initially launched and so on years ago. He
When-
was,
And you mean register, you mean the people that are answering the calls, or
No,
people calling for help?
you and I, citizens, and what he said is that because he works out of the Waterville Hospital, he was saying that what they do is they have information all around the emergency room. They even have a registration station. So if you come in and you think you may be waiting for hours because you have a light rash, they'll direct you over to
Station.
register for e-visit,
Yeah.
start the process, and people are out within 20 minutes with a prescription and everything in hand.
We should try to do that.
So I think
Yeah.
the whole presentation was really about raising awareness.
Right.
And why are people going to emergency rooms when they don't need to?
Could do
Is
this
because
and-
some of them just may not be aware that there's another service.
Yeah, that's definitely something we should be at.
Definitely. Okay, we'll move on to 7C, the Oromocto Area Chamber of Commerce with Councillor Dodd.
Thank you, Worship. The chamber met on March the 12th. And just a few items coming from that meeting. We were fortunate to have an addition of 2 new board members. Deborah George is back on. She's now in a position that she can resume being on the board of directors, and Emily Arsenault of Dog Eared Books. Of course, May the 1st is our Business Awards dinner, so we have an update on that. And we're very pleased with the number of sponsorships to date. The selections will begin on the 3 Business Excellence Award applications for the small, large, and the new. And we're also looking for donations for silent and live options. Then we had, the next thing was the sharing of social posts. We're doing really well in getting things on Facebook and sharing and popping up everywhere. So the chair encouraged all board members to like and share as many posts as possible to create a greater visibility of the chamber and its activities. The next thing was the Oromocto Area Chamber of Commerce Scholarship Award. The Chamber awarded an annual scholarship of $1,000 to an outstanding graduate at OHS. And the deadline for those applications is May 31st. We just, actually, I just came from our Business After Hours, which was hosted by Emily at Dog Eared Books. If you're into reading and things and you haven't been in, it's quite a unique little place that she's got there. She's been in business 3 years and it's really quite sweet. I've often meant to drive by and see the sign and wanted to go in and just never stop. So I was glad she hosted it because it got me in there and it's really quite nice. And there was some networking, wasn't as busy as it could be, but everybody's busy. And the chamber, Oromocto Chamber believes supporting local business is more important now than ever. When we shop local, we keep money in our community, we help small businesses thrive, and we create a stronger local economy. And our next board meeting is April the 9th.
Okay, thank you. There's no consideration of bylaws, and there's no unfinished business, so we'll move down to number 10, new business. We'll start with 10A, the hiring policy amendment with Councillor Murdoch.
Thank you, Your Worship. We resolve that the amendments to the hiring policy as presented in council in committee on Wednesday, the 12th of March, 2025, be approved.
All for seconder. Councillor Whalen. Questions? All in favor? Contrary? Motion carried. We'll move to 10B, the hiring policy and non-permanent employees amendment with Councillor Carr.
Thank you, Richard. Be resolved that the amendments to the hiring policy for non-permanent employees as presented to council and committee on Wednesday, 12th March 2025 be approved. I so move.
Call for a seconder, Councillor Henry. Questions? All in favor? Contrary? Motion carried. We'll go to 10C, the promotion of policy amendment with Councillor Kirkbride.
Thank you, worship, be resolved, promotion policy amendments presented to council and committee on Wednesday, 12th March 2025 be approved. I so move.
Call for a seconder. Deputy Mayor Mawini. Questions? All in favor? Contrary? Motion carried. Go to 10D, the lending policy with Councillor Henry.
Worship, be resolved that the lending policy as reviewed by council and committee on Tuesday, the 18th of March 2025 be approved as an order.
For seconder, Councillor Kirkbride. Questions? All in favor? Contrary? Motion carried. Go to 10E, the employee health insurance with Councillor Whalen.
Thank you, worship. Be resolved that the 3 proposals received, council accepts the Municipal Advisory Corporation Inc.'s proposal for the delivery of employee health insurance, and that Blue Cross, the current provider, be given sufficient notice of termination. I so move.
Call for seconder, Councillor Dodd. Questions? All in favor? Contrary? Motion carried. 10F, the towable man lift purchase with Councillor Kirkbride.
Thank you, worship, be resolved of the 2 quotes received for the purchase of a used towable man lift, council approves the purchase of a 2017 towable man lift from Iron Inventory Incorporated in the amount of $36,900. I so move.
Call for seconder, Deputy Mayor Mawini. Questions? All in favor? Contrary? Motion carried. Go to 10G, the animal control services contract with Councillor Carr.
Thank you, Worship. Be resolved that the contract for animal control services through the New Brunswick Society for the Prevention of Cruelty to Animals in the amount of $52,301 be approved. Funding of $32,500 is available from within the account number 79040-10-2505. The remaining shortfall of $19,801 will be offset from within departmental efficiencies. I so move.
Call for seconder, Councillor Murdoch. Questions? All in favor? Contrary? Motion carried. 10H, the preliminary design for alliterated lagoon with Councillor Murdoch.
Thank you, Worship. Be resolved that the recent submissions for the preliminary design of an aerated lagoon, the low bid of EXP Services, Inc. in the amount of $196,800 plus HST, as well as the additional project cost of $30,000 plus HST for geotechnical exploration be approved. I so move.
All for seconder, Councillor Carr. Questions? All in favor? Contrary, motion carried. With the 10I, the engineering design and inspection services for Schooler Street with Councillor Whalen.
Thank you, worship. Be resolved that the four quotes received, EXP Services, Inc. is authorized to proceed with the engineering design and inspection services for the renewal of Schuyler Street in the amount of $99,480 plus HST. I so move.
All for seconder, Councillor Daw. Questions? All in favor? Contrary, motion carried. Go to 10J, the municipal capital board application for storm sewer project with Deputy Mayor Mawini.
Thank you, worship. Be it resolved that the municipality of Oromocto submit to the municipal capital borrowing board an application for authorization to borrow for capital expense for the following term. The purpose is transportation services of Schooler Street storm sewer pipeline in the amount of $548,000 for a term of 15 years. I so move.
Call for seconder, Councillor Whalen. Questions? All in favor? Contrary, motion carried. And the last one, 10K, updated 5-year general capital plan with Councillor Daw.
Thank you, worship. Be it resolved that the town of Oromocto's 5-year general capital plan for 25 to 29 be approved. I so move.
Call for a seconder, Councillor Henry. Questions? All in favor? Contrary, motion carried. I'll call now for removal for approval for
I move to adjourn.
the adjournment. Councillor Kirkbride, seconder, Deputy Mayor Mawini. Questions? All in favor? Contrary, motion carried.
City sent us a link for that.